recently I was asked what to do if your birth control patch falls off. So I put together this video with a list of some commonly asked questions around the combination birth control patch. Hi there, I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. This channel will provide health information videos to teach you a bit more about your body and help you live better. So please give this video a like and make sure you've subscribed to the channel and click the notification bell for new video alerts every week. Well, let's jump straight in. Number 1, what is the combination birth control patch? It's a birth control method also known as the combined birth control patch or the transdermal contraceptive patch. The combination birth control patch commonly used in the UK looks like a square-sized, light brown colored elastoplast, and it contains the same hormones as the birth control pill. It also works in the same way as the combined pill, stopping pregnancy by preventing ovulation and making the cervical mucus thicker. This makes it harder for the sperm to swim through and fertilize an egg, and it also makes the lining of the womb thinner so that even if an egg is fertilized, the womb cannot support the pregnancy. 1 month cycle of this method is made up of 3 patches applied on the same day of each new week, with the final week being patch free. Number 2, where is the best place to put your birth control patch? One of the common problems with the patch is if it falls off or starts peeling off or rippling off on the part of the skin where you've applied it. So here's exactly what you should do to place your patch properly. Apply your patch to clean, dry, hairless skin. Press it down flat and apply firm pressure till the edges stick completely to your skin. Use the skin on your buttock, abdomen, upper outer part of your arm or the upper part of your chest where you're sure the patch will not be pulled away by tight clothing. Never apply the patch to your breasts, underarms or inner thighs, and avoid any skin that looks red or is sore or is irritated or cut. Each week when you apply a new patch, make sure it's in a different location to the last one to avoid any skin irritation. Among the common reasons for the patch not sticking on properly or peeling off after it's been applied, if the skin underneath is wet or has creams, lotions, powders or other skin products applied beforehand. Check your patch every day to be sure it is firmly in place. If it's come off or become damaged or torn or altered in any way, you should apply another patch as soon as possible. And lastly, don't use tape to fix or wrap the patch to your skin. Number 3 question is related but a few more scenarios added in. Why does my birth control patch keep falling off? As we've said, the most common reasons are if it's applied to areas of the skin that have been poorly prepared or tight clothing is rubbing against your skin where the patch is located. But related to that, what should you do if your birth control patch comes off partly or entirely? If the patch comes off, whether it's in part or completely, you may not have protection. If the patch has come off for less than 24 hours, you can try to fit the same patch back onto your skin if it's still sticky and can adhere properly to your skin. If not, replace it with a new patch altogether. That way you will not need extra protection and you can continue that same cycle. That means applying a new patch on the usual change day. But if it's more than 24 hours, or you do not even know when the patch got lifted or misplaced, then you have to start a new cycle and apply a new patch as soon as you realize the old one is off. And what that means is you have a new change day for your patch cycle, a new day 1. If you did have sexual intercourse during the time when you suspect that your patch was off, then you will need to have emergency contraception, for example, Plan B. Related to this question, can I take my birth control patch off and stick it back on? No, please avoid doing this. Once you've applied the patch, it should stay in place until the change date 7 days later. Taking it off and replacing it later may break your protection, especially if you forget to replace it. The patch is designed to be waterproof, so you don't have to take it off to have a shower or to go swimming. Number 4, how long does a birth control patch last? Each patch you wear provides contraception for 7 days. The protection starts immediately you put the patch on if it is the first day of your menstrual period. If it's any other day, it's best to use extra protection like a condom until you've worn the patch for 7 days. And when you apply the following patch on the same day of the next week, it will be immediately effective. Number 5, will the birth control patch affect my period? Another way of looking at it is, will I have bleeding on the birth control patch? Taking the combination birth control patch every week for 3 weeks temporarily suppresses your natural reproductive hormones. During the patch-free week, most women will experience blood flow from the effect of the patch hormones on the lining of their womb. This blood flow tends to be lighter than your usual period. However, the patch may cause the periods to stop in other women, and yet others can experience irregular bleeding episodes like spotting or breakthrough bleeding. And the 6th question, if you're on the patch, do you need to take the emergency birth control pill in the last week when you do not need to wear a patch? The answer to this is no. If you've been using the patch exactly as recommended and it's time for your patch-free week and you have sexual intercourse during that week, you are protected. You do not need to use an emergency birth control pill. If, however, there are delays, for example, you don't apply the patch until 2 or 3 days after the day you should have applied it, then you will need to use emergency contraception. Your protection in the patch-free week is covered by the hormones accumulated in your body when you had the patch applied during the previous 3 weeks. So to round up the video, let's just look at a few pros and cons for the combination birth control patch. For the pros, you only have to change it once a week. You don't have to remember to take it every day or apply it before sex. You can also use the patch to skip a period, and you have control over the method, which is better than some methods like withdrawal. And here are the cons. The patch does not protect you from sexually transmitted infections, so use a condom if necessary. The patch has a higher risk, up to twice the risk of causing a blood clot, a heart attack or stroke compared to some traditional combined contraceptive pills. But remember, the overall risk of developing blood clots with any of these combined methods, whether it's the patch or the pill, is still a lot lower than your risk when you are pregnant or just after having your baby. You're also at the highest risk of developing a blood clot in the first year. So if it was going to happen, it's more likely to happen within the first 12 months, or if you stop it and restart it after 4 weeks or more. Now, please don't use the patch if you've had blood clots previously, have high blood pressure, if you smoke and are over the age of 35, have breast cancer, have liver tumors or liver disease, are over the weight of 90 kilograms or have a BMI that is equal to or more than 35, within 3 weeks of having your baby, or if you suffer from special types of headaches known as migraine with aura. That's it for today. Let me know if you have any more questions about the combination birth control patch or any other birth control method. Don't forget you can use our email service to send a question and get fast responses straight into your mailbox. Next time I'll be talking about treatment options for painful fibroids. So please like this video, and if you haven't yet subscribed, go ahead and do so now and click the notification bell so that you can get alerts about our new videos every week. While you're waiting for the next video, check out these two here, and I'll see you again soon.